All right, thank you, Mr. Chair. Ladies and gentlemen of the House, this is the main bill for the Healthy Iowa Plan. We've had about a month long talking about this plan and the ins and outs of the specifics. I wanted to ask if you would indulge me and share one story about why I think it's important that we focus on a plan that focuses on Iowans being healthy. I grew up in a big family, 8 kids. Every Sunday, we got the privilege to go to Grandpa and Grandma's farm in Dewar, Iowa. And it was a blast. Spent every Sunday at Grandma and Grandpa's farm. And my father would drop us all off 1 mile away on a gravel road away from the farm. And we would all have to run to the farm. Finally, I got smart and said, "Dad, why are you doing this? Why do we have to run this?" And he said to me, and I don't know what kind of health plan my father had. We were definitely not rich. He worked 3 jobs to support my mother while she went to college. But he said to me, "Walter, I can't afford for all of you not to be healthy." And so he instituted, without us thinking about it, because he always made it fun, an idea for us to stay in shape and be healthy. And then my grandma always had part in that too, because she would always make us peanut butter and banana sandwiches, and she wanted to make sure we ate the bananas. Well, I hated the bananas, and I always sat in the back of the station wagon. On the way home, I would throw the bananas out the back window and eat the peanut butter. My point is this: there's a reason why we want to be healthy, and there's a reason why a plan like this that institutes incentive and investments in people being healthy is a good thing. It helps us as a state, as communities, as people working together to be healthier. It helps in the whole overall think of how Iowa thinks about being healthy. It helped me when I was a little kid to be healthy and understand that was part of my lifelong think of being healthy. That's why I think it's important for us to embrace the Healthy Iowa Plan. It's a good plan. And it counters what we've seen in Medicaid for years. And Medicaid is devouring budgets, nationwide and state budgets. Across the country, I've seen estimates that says Medicaid has $100 billion of fraud. That's nationwide. By the year 2020, just the new enrollees in the state of Iowa, will cost $834 million. That's just the new people. That's not free money. That's money we will be paying for in federal dollars, and 10% of that will come out of our budget, $83 million. I fear if we continue to go down the road of Medicaid expansion, we will be making the choice between education and Medicaid in this chamber. We'll be making the choice between education dollars and Medicaid dollars in this chamber. I hope we don't do that. The Healthy Iowa Plan covers uninsured individuals ages 19 to 64. Traditional Medicaid will continue to serve the aged, blind, disabled, children. However, Iowans served by the Healthy Iowa Plan will be served by a more modern functioning health care plan than the old Medicaid plan. The Senate Democrats have proposed expanding old Medicaid with no changes to delivery, no rewards for quality or outcomes, and no incentives for members. They simply want to add 115,000 newly eligible Iowans to a system that has already grown by 65% in population and 129% in costs over the past decade. We have a better alternative. We have an Iowa alternative. The Healthy Iowa Plan is designed to cover this entire newly eligible population through state coverage or private coverage, but to do so in a way that increases quality health care outcomes. The Healthy Iowa Plan. This bill also incorporates medical malpractice reform, strengthening expert witness standards, utilizing pretrial screening panels, utilizing certificate of merits for experts, and evidence-based safe harbors. With that, Mr. Speaker, those are my opening comments on this amendment.